Welcome in United Kingdom healthcare. At first we will talk about the major government-sponsored healthcare system. The National Health Services, NHS. The most of finance of healthcare systems is from NHS, which is set as 85%. All residents are entitled to healthcare under this system. UK does not set age and income requirements on public healthcare coverage. Public healthcare accessible to all UK permanent residents. The school-aged children from the poorest areas are 2.5 times more likely to be admitted to hospital in an emergency for asthma than those in the richest areas. From 2005 to 2006, school-aged children in the most deprived areas had double the emergency admission rate for asthma compared with their least deprived counterparts. However, by 2015 until 2016, the gap had grown to about 2.5 times. That gap alone is costing the NHS £8.5 million per year. That level of ill health means the average 65-year-old costs the NHS 2.5 times more than the average 30-year-old. In BSP, a 90-year-old costs more than 7 times as much. In 2017, the UK spent £197.4 billion on healthcare. This amounts to 9.6% of annual GDP. The UK has 4 regions: Scotland, Wales, Northern Ireland, and England. Healthcare spending in 2017 and 2018 in Scotland was £2,368 per person, while in England it was £2,182, and Wales £2,324, and in Northern Ireland £2,320. This indicates that Scotland's NHS is better funded and resourced to serve the population in need of healthcare. Scotland's NHS also provides 4.2 hospital beds per 1,000 of the population, while the UK as a whole only has 2.6 beds per 1,000. This is one of the worst bed-to-population rates in the OECD, placing the UK 30th place out of 35. Now, the diseases in UK. There were 45 million cases of brain disorders in the UK. And its cost is €134 billion per year. The lung disease is the 4th most costly disease area to the UK. Respiratory diseases kill 1 in 5 people in the UK. And cost the NHS more than £11 billion per year. Coronary heart disease and stroke are the biggest causes of death in the UK. Healthcare costs relating to heart and circulatory diseases are estimated at £9 billion each year. Musculoskeletal condition costs the UK economy between £3.80 and £4.8 billion a year. The cost of healthcare rises each year by 1 or 2%, due to increasing wages and costly new drugs. In 2017, it was found that the UK had the lowest healthcare expenditure per capita, $3,825, according to other countries. In UK, the percentage of the government expenditure is 79% of total health expenditure. The total long-term care expenditure per capita in dollars is $738. Finally, the observations. The number of beds is lower than average, so the access to care is very low, and from data the numbers of doctors and nurses is slightly low. There are lots of complaints from patients, as the waiting time is very long, and delayed discharge in winter. Salaries of doctors is higher than nurses, which reduce the numbers of nurses in UK. Surveys showed that mortality rates for acute myocardial infarction and ischemic stroke were the second highest respectively, compared with the wider of the EU averages. UK average is the best. Cancer survival rates were the lowest of the comparator countries, for breast and colon cancer, with cervical and rectal cancer survival being the second lowest. Maternal mortality in the UK was higher than other countries. How it can happen, and we need them for the new generation, children. How can we consider this system a good one?